Okay, so I'm now on to part 2 of my series. First, I will start off with shortening the title of this act to just referencing it as the act itself instead of having to say the full title all the time. Second, I wanted to give you sections and page numbers on where you can find the sections I'm going to be talking about. So it should be pretty easy for anyone to pull those sections up after they have downloaded a copy of the act for themselves. Now, I didn't answer one question in my introduction, which is why I'm doing this in the first place. Mostly to help you figure out who to vote for in our upcoming election. No surprise. However, I'm not going to tell you who you should vote for, but rather suggest you figure out for yourself, with actual knowledge and less rhetoric, if this act is a good thing or a bad thing for you, your family, our country, etc., and then vote accordingly. Again, let me preface all of what I'm going to cover in this series with the fact that what I am giving you is actual verbiage from the act itself, and then my thoughts and opinions on it. Meaning you really need to pull these sections up yourself, do your own research, and come to your own conclusions as to how it affects you. And so I begin with section 2711, which is page 14 of the act, that talks about no lifetime or annual limits. Now, as you can see in the slide, I brought up the language for everyone to read. And what I think is interesting in this section is that it says that specific covered benefits that are not essential health benefits under this section, or under the section of the Patient Protection and Affordable Care Act, to the extent that such limits are otherwise permitted under federal law, which basically means that, guess what, there will be some limits. And it's going to be up to the government to determine what those limits are going to be and what those limits can be on. Now, the reason why I bring this up is because there are a lot of people out there who like to make the argument that this is a great thing for America, this is a great thing for America's people, and no, the government's not going to be writing your health insurance policies. Well, in this very first section, I don't see how you could argue otherwise. If the government is going to be the one determining what can have limits on and what can't have limits on, I'm not sure what else you would call that. The next section I want to bring up is section 2717, which is on page 20 of the Act, and it talks about ensuring the quality of care. Again, if you look to the slide, you'll see the actual language in front of you. This section I find incredibly interesting, and I'll go in more depth on it later on. But basically what it's saying is if you participate in any one of these programs, they're going to reduce the premiums of your health insurance. So my question is, A, who pays for these programs? Do we have to pay for these programs? And exactly what is it that they're going to be telling us in these programs? Again, it goes to that same argument that people are making that, no, the government's not going to be writing these policies. But yet, if you go to a government-sponsored program and listen to somebody talk about what they feel your physical fitness and nutrition should be, you're going to get a discount on your premium. Again, I fail to see how that can be anything but the government's hand into something that, quite frankly, I don't feel they should have their hand in. Now, the last section I'm going to cover in Series 2 here is section 2717, again, page 20, that has to do with the protection of the Second Amendment, which is gun control, gun rights. The reason why I bring this up is because when I first started this process of reading this act and making down my notes, this really struck me as odd, and the first thought I had was, what the hell is this doing in an act about health care? Really? We have to protect gun rights in a health care act? But it's pretty obvious. A couple of seconds later it dawned on me, well, duh, they needed votes in order to get this thing to pass. And it was, you scratch my back and I'll scratch yours. And the thing that I find incredibly interesting is that if this is supposed to be so great for our country and so great for us individually, then why would they have to resort to doing that to pass this? And so I will leave you with that thought, one that I think everyone should seriously consider. Thank you very much for listening, and stay tuned for the next series.